Hello there, this is Christopher Westphal. I'm in the Medicare business, helping people with Medicare from coast to coast. And tonight I have some late breaking news. Something just came out across the wire late today, November 20th, 2023, as I'm with you tonight live. And if you have comments, if you have suggestions, if you have something you want to say, join us in the live chat. We're on YouTube. And after the fact, please feel free to leave your comments after the discussion. I try to read every one of them, read at least 500 of them over this past weekend. And now we're back for Thanksgiving week. And the American Hospital Association just sent out a letter to the Deputy Administrator and Director, Center for Medicare and Medicaid Services. I'm going to get into that in just a minute, but it's very concerning about Medicare Advantage, and what they're all concerned about, you need to be concerned about as well, because basically the Medicare Advantage companies are telling CMS, no, we're not going to go by your rule. No, we're not going to treat people the same as we do on Medicare, and they're very concerned about this. And so anyway, I'm going to get into that with you, but first I want to cover what some of the politicians have been saying about Medicare Advantage, some new, some old, something that you've probably never seen before, some opinions from some people that are current and former politicians. And I want you to see what just happened this past week first.
And then expand Medicare Advantage plans. Seniors love that. And let's make sure we do that so that they can have more competition. That's how we'll deal with entitlement reform. And that's how we'll start to pay down this debt.
One of the problems is I don't believe many of our local politicians, and I've met Nikki Haley in person. We actually had ice cream with her, my family and I did, in downtown Charleston, because she's from here. And when she's saying something like this about Medicare Advantage, it goes consistently with what I've heard from other politicians that I've had meetings with of late. And I won't get into names in particular, but when I hear this statement,
the wealthy, and then expand Medicare Advantage plans. Seniors love that. And let's make sure we do that so that they can have more competition. That's how we'll deal with
expand Medicare Advantage plans. And if you look at the donor list, if you look at who's backing her, one of those people, one of those organizations may be with us tonight, maybe not. Not sure. Let me just share with you what I'm going to show you. There's a congressman in Arizona who did a community event. He did a live stream. And I asked our local politician to do the same thing and provide a forum where we can listen to the local people and provide some experts on things like Medicare, especially during the annual election period, and give some feedback. Well, this congressman did, much to his credit. And I'm going to play that for you in just a minute. But he made the mistake, I think, of being duped, just like Nikki has, in my opinion, on bringing in somebody from the industry, but not the entire industry, not an unopinionated, unbiased broker or an arbiter of the facts. No, he brought in somebody from an industry lobbying firm, but not just any industry, specifically, as they say, the riches are in the niches, the niche of Medicare Advantage. That's who he brought on for his live stream for the entire state, for all of his constituents, about Medicare, to talk solely about Medicare Advantage. And I dissected it and I pulled it apart and I put what's actually happening with it. It's an excellent piece and it took me a lot of time to work on that. So please check that out. It's going to be here in just a minute. But I want you to hear some interesting words before I get into all that. What the American Hospital Association just sent out today and what this congressman just did about Medicare Advantage. But first, let's hear from a blast from the past about what he thought about Medicare Advantage.
Let's make some other changes that would result in actually the 80% of seniors who aren't in Medicare Advantage getting a better deal. So
First, let me provide some context. When President Obama was doing this, when he was making this, I got my camera all messed up the other day when Hannah and Scarlett came in. When he was doing this, this was February 10th, 2010, right on the crux of the debate of the Affordable Care Act. And they're trying to find $700 billion to fund the Affordable Care Act because it just wasn't in any budget that could be passed. It just was not there. So they decided to take it from the Medicare funds. And I got in trouble for saying my opinion on it back in the day, actually a lifetime ban from an insurance company whose organization was sponsoring the bill to take $700 billion out of Medicare. And yes, I ran my big mouth, and boy, the next day got a cease and desist letter by FedEx saying that you're banned. Don't ever talk about our company again. out of your lips. And I pretty much abided by that. However, this is interesting because during this discussion, they're trying to find money for it. And he's saying, why don't you take it out of the Medicare Advantage part of Medicare? Because it's not real Medicare anyway, right? There's no guarantee to Medicare Advantage. And then he goes on to talk about how many people are participating in Medicare Advantage back at the time. And at the time, it was 20%.
We can address some of the broader issues, but I just want to focus on Medicare Advantage because I haven't seen an independent analyst look at this and say seniors are healthier for it or taxpayers are better off for it. That's what we're talking about reforming. We're not talking about cutting benefits under the Medicare program as is required under law. What we're talking about is Medicare Advantage. And it may be that some people here think that it's working. I know that there are some Republicans who are sitting at this table who don't think it's working. You can argue and say, okay, let's not do Medicare Advantage and let's not close the donut hole, for example. Or there may be other ways you want to spend that money, but I just want to establish whether we've got some agreement that the Medicare Advantage program, which is what we are proposing to reform, is actually not a good deal for taxpayers or for seniors, and certainly not a good deal for the 80% of seniors who aren't in Medicare Advantage, because, by the way, they're paying an extra premium of about $90 a year to subsidize the 20% who are in Medicare Advantage. And I just want to point this out, Tom. $180 billion of it's going to insurance companies. It's not going to seniors. It's going to insurance companies, including big insurance company profits, without any appreciable improvement in health care benefits. That's not a good way for us to spend money. I agree with you about the fact that the prescription drug plan added to our deficits because we didn't pay for it. And I just had to point out that didn't happen under my watch. It happened under the previous Congress. There's some people, John is an example of somebody who was true to his convictions and didn't vote for it.
I didn't vote for it.
But the fact of the matter is that that was costly, and we do have to deal with that. On the other hand, the problem I don't think is that we gave seniors prescription drug benefits. I think the problem is that we didn't pay for it, and we should try to find a way to pay for it. Taking some of that money out of Medicare Advantage and putting it into that donut hole does pay for it. All right, I really breached protocol here, but I thought that was important to just get clear. We are talking about Medicare Advantage in terms of where these cuts come from, not Medicare benefits through the traditional Medicare plan. When I say that Medicare Advantage is not a useful way for us to spend tax dollars to provide health care to seniors, at least the way it's currently structured, as I said, that's not a Democratic idea. I mean, there are a whole bunch of Republican commentators and some of the folks who've sat around this table before who suggested that that's probably right. You can make an argument that whatever savings we get out of Medicare Advantage should not go to filling the donut hole, for example. That's a legitimate argument. You can make an argument that it should go just to deficit reduction. Those are all legitimate arguments, but my point is that the savings that are obtained here are from a program in which insurance companies are making a lot of money, but seniors who are in these kinds of programs are not better off. And the 80% of the people who are in these programs are paying an extra $90 a year to subsidize the folks who are in them. And that just doesn't seem like a good deal for them or for the taxpayer. What I'm saying is that on Medicare Advantage, that does not have to do with the concerns that you've got about hospitals or doctors getting properly reimbursed. This is a program that's going to insurance companies. But
was he right back in the day? Did it get under control by federal spending? Did they rein in the Medicare Advantage plans in the last 13 years since that video was made? No, they actually didn't. They're getting more money than ever. I want to share with you what's going on with the American Hospital Association. Why are they so mad? This just came out. The American Hospital Association urges CMS to swiftly correct Medicare Advantage plan policies that appear to violate the 2024 rule. as we're coming into 2024, they're supposed to do a whole bunch more parity programs, which means they're supposed to have Medicare Advantage working the same way that original Medicare does. We all know that they don't. We've seen the testimony, we've seen the stories, we've seen the reports from the Office of Inspector General and on and on and on. Stories about how they just do their own thing in Medicare Advantage. They don't do what the coverage determinations in original Medicare are. So I want to share with you just part of this letter. I don't want you to be bored out of your mind, and I never do. Let me share with you a part of this. It says, this just came out today. On behalf of our nearly 5,000 member hospitals, health systems, and other healthcare organizations, and our clinician partners, the American Hospital Association strongly supports the CMS efforts to improve how coverage works for Medicare Advantage enrollees through the policies codified in the calendar year 2024 Medicare Advantage rule. So the rule is great if it's going to be applied. And here's the problem. These policies, when implemented, don't hold your breath, will promote more timely access to care. If there was timely access to care before this rule in 2024, why would they have a new rule? The rule that the lady, the attorney from Wisconsin that defends seniors against Medicare Advantage plans said, we don't need a new rule. It's already in the law, but they just don't enforce it. But they are making a new rule. You don't follow the old rule, we're making a new rule. These policies, whenever implemented, will promote more timely access to care. They will ensure better alignment and coverage parity. That means the same thing between traditional Medicare and Medicare Advantage, and increase oversight of Medicare Advantage organizations. We can only hope. Recently, we urged CMS, I brought that to you as well, to conduct rigorous oversight to monitor compliance with these policies and to ensure that appropriate action is taken in response to any violations. They want to hold Medicare Advantage companies accountable because they haven't been up to this point. We express concerns about reports we have been received from our members that certain Medicare Advantage organizations, let's see, where is it right here? We express concerns that about reports that we received from our members, certain Medicare Advantage organizations indicated that they do not intend to make changes to their utilization management programs in response to your new rule. And otherwise, in other words, you can take your rule and you can do something with it, because we, Medicare Advantage organizations, have no intention of following your stinking rule. And there's 6 pages of proof of that right in here, including one from an insurance company with their actual information saying that. And I'll show it to you. It's on page 6. In other cases, it appears some plans are making changes to their terminology that they use in denial letters that may be intended to circumvent recent CMS rulemaking. Can you imagine? They're just going to change the language just a little bit. Why would they do that? Oh, I know. So that you can get around the rule. And we're just going to call it like in Medicare Supplement. When people come to me and they say, well, attained age is going to be better than issue age, or community rated is better than issue age and attained age. It's all the same thing. They're just literally changing the verbiage and justifying a rate increase by another word. Literally, it's the same thing. Let's see. Oh, here it is right here.
I don't know that it needs to clarify, because it's already a rule that Medicare Advantage plans must cover the same as must provide at least the same benefits as original Medicare.
And that is exactly my point, that it's not a problem with rules, it's a problem with compliance and enforcement. In other words, the Medicare Advantage plans basically have been flouting their obligations under existing law without a new rule, correct?
Absolutely correct.
Yeah. Let's see. I'll make this bigger so you can see it better. Indeed, one plan recently issued guidance to its network providers that I'll show you, indicating that they plan to continue to use internal criteria beyond the traditional Medicare criteria to evaluate inpatient admissions. That's the biggest problem. Inpatient admissions, when they want to deny that. We believe this circumvents CMS's rules regarding the use of more restrictive coverage criteria and the requirement that plans must adhere to certain public accessibility and evidentiary standards. Just make it level across the whole playing field. Similarly, we understand from our members that at least one other large Medicare Advantage organization has reported that they will continue to use Milliman clinical guidelines criteria to evaluate inpatient admissions. And yet another plan has issued a policy that adopts a more stringent standard than CMS for evaluating a physician's judgment at the time of admission on whether the care was expected to extend over 2 midnights. Look at the bold right there. We are deeply concerned. Why are the hospital administrators concerned? That practices will result in the maintenance of the status quo, where Medicare Advantage organizations apply their own coverage criteria that is more restrictive than traditional Medicare, proliferating the very behavior that CMS sought to address in this final rule, resulting in what? You think this is timely? This came out 5 hours ago. Resulting in inappropriate denials of medically necessary care and disparities. I cannot draw straight to save my life. Disparities between Medicare Advantage beneficiaries and those in traditional Medicare. Attached, we provide additional information regarding these potential discrepancies between these plans' guidance and the CMS rules, and they go into detail. Given the importance of these issues for beneficiaries' access to care and our hope that to address these concerns, says right there, address this prior to the effective date of the final rule, we respectfully request a meeting as soon as possible to discuss these concerns. Ooh, they made this public. That's not going to be happy between the Medicare Advantage companies and the Hospital Association. They go into the more restrictive policies. More restrictive policies, more restrictive policies. You can read that. I'll put it in the show notes, otherwise known as the description of the video. Uh-oh, I recognize those colors. Let me just go to page 6 and see what they brought for our attention. This is a letter from Aetna, Medicare Advantage Aetna, not Medicare Supplement Aetna. It's a different brand, different company, really. Medicare Advantage Aetna says, beginning January 1, 2024, the Center for Medicare and Medicaid Services will introduce regulations and changes related to Medicare Advantage plans, prior authorization coverage criteria, and access to care as set forth in the rule. Aetna seeks to provide you with some information on how Aetna Medicare Advantage plans complies with the 2 midnight rule. Go down there where it's highlighted and it says, our medical necessity reviews. We will review the stay to determine whether the inpatient hospital admission was appropriate. We will review. The entire medical record may be reviewed to support or refute the reasonableness of the physician's expectation, but we will use entries after the point of the admission order to interpret what the physician reasonably should have known or reasonably should have expected at the time of admission. It is important that you provide us with detailed clinical records to support the physician's judgment. Our Medicare Advantage plans, it says right here, our Medicare Advantage plans are not required to follow the 2 midnight presumption. Well, that's part of Medicare's law there. And what they're talking about is the 2 midnights required before Medicare pays for you to go to skilled nursing. And it's the skilled nursing that we've been talking about is the biggest disparity of all time between original Medicare, where you can go to any provider that you want to in the country as long as they accept original Medicare, which is the biggest network there ever was, or if they're just going to go ahead and routinely deny your care. And the skilled nursing is where this routine denial of care happens all the time, all the time. Please like this video so I can stay up late at night away from my family and continue to bring you news that may affect you or someone that you care about that has to rely on these decisions for Medicare. I just want to let me just jump out down here and show you this comment that just came in yesterday. There was a flyer on my subsidized housing apartment door, a flyer on the door about an info session about Medicare and healthcare changes with coffee and donuts in the community room, hosted by Medicare Advantage insurance agent. Yes, sir. And there's one that I posted in the chat for our people today. I didn't have time to grab the graphic of it, but it specifically talked about the fact that this person went to go talk to their Medicare agent this year during the annual election period and said, I want nothing to do with Medicare Advantage. The agent said, "Oh, you're already on a Medicare Advantage plan. That's what I put you on when you were 65." And the senior said, "I didn't want to be on a Medicare Advantage plan, and I didn't have any choice." Nobody gave them the choice, you see. Nobody told them there was two different ways to go. And that's why I think it's important to tell in every one of these videos, I don't want to be like my competitors out there that are just shoving one product, whether it's Medicare Supplement or Medicare Advantage. I think that the knowledge of good and evil, just give you the knowledge and let you decide based on your finances and when you go to the doctor and what coverage you need, but at least provide you with the choice. And it starts with this, the information that's in your Medicare and You guidebook. It clearly says there that there are two different ways to go. Decide how you want your coverage is how it's literally laid out. Do you want your coverage with original Medicare that you paid for, which is Part A in the hospital, Part B out of the hospital? Add to that a handy dandy Part D drug plan specifically tailored toward you. This year, many of the companies are doing, well, one of the companies is doing super, super cheap premium, and that's going to spur competition. I think that's a great thing. But you pick a Part D plan based on the drugs you're taking. You don't just take one that's lumped in and somebody says, "Hey, yeah, there's Part D drug benefits thrown into your plan. Hope you like it." Because if you're thinking about the other thing that you'll hear in just a second with the guy from the Medicare Advantage community organization that just sponsors Medicare Advantage all the time. Oh my goodness. You're going to hear him talk about how great it is that Part D is just rolled in there for your benefit and it doesn't cost you a thing. Really? Okay. So we're going to talk about original Medicare, A and B, throw in a Part D to cover your drugs. If you put a Medicare supplement in there, it takes care of the 20% that Medicare does not cover for you, and you still maintain the freedom and the flexibility to go anywhere you want to for your healthcare with no prior authorization. That's huge. No prior authorization, which means no one can tell your doctor, no, you're not going to do that. Even after admission, like the company I just showed you from the American Hospital Association, that's not my slide. That was not my information. That's from the American Hospital Association showing what was given to the physicians recently that seems to flout what the Medicare rule is. Not only the old rule, which already was there, and when the lawyer said, we don't need a new rule, we just need to enforce the one that we already have. No, now they're making a new rule, and they're still saying we're going to do our own thing. So you could do original Medicare and skip all that. Skip the denials of care. There's not even an option to deny your care on the original Medicare with the supplement because the supplement has no decider in it. The supplement just goes right around and pays for what Part B would have paid for. Or you go to Medicare Advantage where you have a network of doctors that can change at any time. They do have more restrictions. They do have prior authorization if you're going to spend them money. And they do have referrals that are required, and they do have step therapy that's required, which means let's try something cheap first before we try something effective. That's all part of the Medicare Advantage world. So now I feel like I've done my due diligence in telling you, you should look at the two different ones here. And if you had an agent that did not show you what's in your Medicare and You guidebook, first of all, let's go full screen and let me show you this one thing. Here's the Bible on Medicare. You get this book every year. Every day, I get no less than 100 new comments of somebody saying, I didn't know that something else existed. It's in the book. And if you're asking a question about how does this work, how does this work, and how does this work, and you're retired and you have nothing better to do, I highly encourage you, watch several of the hundreds of videos that are on this channel that address probably every question that's ever been asked about Medicare. It's in here on the channel. And many times it's funny because I'll be there with my wife. We're at dinner. We're out with the family. I'm reading comments and I say, I literally covered that yesterday. That same exact question was yesterday. So it's in the channel, but this is the source of the information. A couple of things in here I disagree with because they don't know much about Medicare supplements. They say that when's the best time to get a Medicare supplement? That is when you're brand new to Medicare. Yes, it's super easy to get a Medicare supplement when you're brand new to Medicare because there are no health questions. It's your open enrollment time, the true open enrollment, not this period of time, which is not really open enrollment. That's your real open enrollment when you're within 6 months of your Part B of Medicare, your start date. That's your time when you can do anything you want to without underwriting. And that is good. However, what in the world did that just do? However, you can get on a Medicare supplement later in life if you have an experienced broker that knows how to navigate the underwriting world. Just because there's underwriting does not mean it's impossible to get underwritten. You just need somebody who knows what they're doing with underwriting to tell you whether or not you can get through underwriting and get the plan that you should deserve, your Medicare supplement, if that's what you want. And if you go to this website right there, I tell you how the underwriting process works. I'll go through example questions and tell you whether or not you might be a candidate to either get off of your Medicare Advantage plan or get a Medicare supplement later in life after you've already been 65. One little caveat, because there's so many, if you start Part B of Medicare later in life because you're leaving an employer plan and you just didn't need Part B, which is true if you're an employer that's more than 20 employees, you can defer getting Part B until later and there is no penalty. That's covered in the book too. So if you're starting Part B at 70 years old, you have your initial election period, you have your open enrollment, and you can get a Medigap or Medicare supplement plan, same thing, with no questions asked. But again, too many agents, and I think it's criminal, they're not telling people that they can do this. They're not telling people that there's another way to go. So now let me share with you what I think is, here's my personal opinion. I think it's horrible that this congressman trying to do the right thing, because he doesn't know, he relies on experts. He doesn't know that there are two different ways to go. And so we have here a huge long diatribe about all the positives and not one thing negative about Medicare Advantage and 60 seconds worth of Medicare Supplement, where he admits he doesn't know what the plans are in Medicare Supplement. He just knows that they're standardized, because that's not what he gets paid for. He works for 𝗍𝗲. That's the organization that somehow lobbied Congress enough and CMS to require that all of us agents every single year have to take a certification and a test. And who do we have to pay to take that test? Every year we have to do an indoctrination about Medicare Advantage. And who do we have to pay money to be certified every single year? And I've done it now for at least 10 years. Who is it that we pay the money to? It's this organization. It's the organization that exists only to promote Medicare Advantage and doesn't know anything about Medicare supplements and won't talk about it except to give it basic lip service at the end to say that they've been unbiased. You've got to see this. And I apologize for the edits. I make it a little bit long, but I just want to refute each thing that he's saying in there. This is the vice president of Aetna. I'm sorry, of 𝗍𝗲, American, yeah.
Next, we have Mark with America's Health Insurance Plans for an explanation of Medicare Advantage and supplemental insurance.
Both. He's going to cover both.
Thank you, Congressman. Hi, everybody. Pleased to be here. So I'll start by a little bit of context. The latest CMS data show that in Arizona, there are about 1.4 million people who are eligible for Medicare, and more than 722,000 have enrolled in the MA program. Nationally, there are almost 32 million people now enrolled in this program. So it is an increasingly popular option, but as the Congressman made clear before, this is an option, it's not a requirement. But more than half of people who are eligible are now choosing to enroll in the program. And the satisfaction rates for people in Medicare Advantage are in excess of 90%, 90%. So it's a very, very popular and growing program. Also want to clarify something that I think hopefully was clear from the discussion so far. Medicare Advantage is part of Medicare. If you enroll in it, you're still a Medicare beneficiary. It really means that you've chosen to receive your Medicare coverage through a different vehicle, through an insurer that is contracting with CMS, and the insurer will be subject to oversight by the agency.
How's that working out for you?
And as Peter from CMS noted earlier, each plan must provide all the benefits that are available to you in original Medicare, but the benefit and certain processes can vary from the standard product.
But I don't know that it needs to clarify, because it's already a rule that Medicare Advantage plans must cover the same must provide at least the same benefits as original Medicare.
And that is exactly my point, that it's not a problem with rules, it's a problem with compliance and enforcement. In other words, the Medicare Advantage plans basically have been flouting their obligations under existing law without a new rule, correct?
Absolutely correct, yes.
So in terms of benefits, Cost sharing for certain services can be different than original Medicare. Oftentimes they're less, but they can vary. Every plan has a maximum that you must pay out of pocket each year. So if you've incurred cost up to that maximum, then the plan will cover everything above that. But it's not like a high deductible. Like in most cases, you're paying, whatever it is, 20, 30, whatever the copayment might be if you're going to see a physician or you're paying for the hospital. But if your costs add up over the course of the year and you hit that maximum, then you pay nothing further beyond that. And original Medicare doesn't have that. The only way to avoid that in the original Medicare program would be to go and purchase a supplemental policy. Most Medicare Advantage plans offer a package of extra benefits that are not available in original Medicare. And many people find these very valuable. And typically, you're not paying any extra premium to receive these. This would be on top of the premium. I'll get to the premiums in a second, but these are benefits like vision, hearing, dental, fitness benefits, coverage if you're out of the country. These are very popular benefits, and there are a bunch of other types of benefits. The key, which was mentioned earlier, is that all of this can vary by plan, the cost sharing, the premiums, the available benefits. So it's very important to review the particular options that are available where you live to consider what you might want to choose.
And they are trying to enroll in Medicare coverage for the first time. They meet with a broker or see an advertisement about Medicare Advantage plans offering $0 premiums and boundless supplemental benefits. Sounds good, sometimes too good to be true. Are advertisements like this misleading? And if they are, what should federal government, what should we be doing about it?
They are, and this has gone on for years. On all of our public presentations and our counseling, we beg the consumers, do not choose your health, your prescription drug coverage based on an advertisement. The advertisements will focus on the zero premium, zero copay at a primary care, but we really want them to look at things like what is the copay for inpatient hospitalization per day? And when it comes to Medicare Advantage, also know that maximum out-of-pocket, which would be a limit to their financial risk. So the advertisements over the years have gotten more aggressive, and they do focus on those added benefits.
These plans operate in similar ways to what you may have had if you had coverage through an employer. So often you'll have to use doctors that are only in the plan's network of contracted providers, but CMS has to oversee this to make sure there's an adequate network to ensure that everybody enrolled has access to the physicians and the services in the hospitals that meet their needs.
The Centers for Medicare and Medicaid Services reviewed 52 Medicare Advantage plan directories and found that over a third of providers were erroneously included, either because the provider did not work at the listed location or because the provider was out of the plan's network. These are often known as ghost networks. Ghost networks make it difficult for a beneficiary to determine if their doctors are in network at all, and this misinformation often leads to unexpected and higher out-of-pocket costs for Colorado seniors.
Some plans will provide coverage if you go out of network, but cost sharing is likely higher. Sometimes you do need to get approval before getting certain drugs or services covered.
Prior authorization is a nightmare.
It cripples my patients, it cripples my medical practice.
It takes a lot of the joy out of medicine.
So the amount of time that it takes myself and my office staff to go through that process now for almost every prescription we write has gotten to be an enormous problem both for us and for our patients. They're spending something like 15 hours a week per physician just filling out these forms and waiting on hold for the insurance companies.
Dealing with prior authorization is just a disaster, both for physicians, but more so for the patients. They're put in situations where they're not sure whether they're going to get their medication. They're not sure whether they're going to be able to have a test.
It takes time away from other patients. It frustrates physicians endlessly. I would hope that patients would recognize that doctors and patients are really on the same team, that we are as frustrated with this as they are. This is a great opportunity for patients and physicians to work together.
In a report released last year, the Inspector General of the Department of Health and Human Services identified a large number of instances where Medicare Advantage companies refused to authorize treatment for care that clearly met Medicare coverage. In one case, a cancer patient had a common scan needed to determine if the disease had spread, delayed by their insurer for more than a month.
Medicare Advantage also has a range of processes like care coordination, disease management to help with particular conditions. And there is research that shows that all of these provisions are helping to limit unnecessary low-value care and help promote better health for people who are in this program. In terms of costs, many plans don't charge any extra premium for the coverage. So if you enroll in Medicare Advantage, you'll be paying the same, in most cases, you're paying the same Part B premium you would pay if you were in the original program. But and you're typically getting Part D coverage as part of that package and also not paying any extra premium. But some plans do require that you pay an extra premium. So it is, again, important that you check to see what your options are. If, however, you want to stay in original Medicare, or you're in Medicare Advantage and you want to switch back to original Medicare, many people do choose to purchase a supplemental product, given some of the design elements of Medicare, like a 20% coinsurance for many services and no out-of-pocket limit. These are also separate products offered by insurers. They're regulated by the states, but there are federal standards as well. Now, unlike Medicare Advantage, these products aren't offering a complete package of benefits. They're basically wrapping around your original Medicare benefit, so they're picking up most of your out-of-pocket costs from original Medicare. You can choose any doctor that accepts Medicare, just like if you're in original Medicare, but you pay for this coverage on top of your original Medicare coverage, and if you want your drug benefit, you'd have to go and buy a separate policy for that as well. There are a number of different plans in the market, but they're labeled in a particular way, and each plan within a given label is standardized. So you can go to CMS has a lot of resources about the plans that are available and to see what your premiums will be. And I'll just, last point I'll make is that depending on when you sign up for these products, they could potentially be subject to a process called medical underwriting. So your premium might differ depending upon whether the insurer in this product offers it. I'm talking only about the Medigap policy. This doesn't apply in the Medicare Advantage. Everybody is charged the same premium for that. So with that, Congressman, I'll throw it back to you.
Yeah, and guess who he works for? AHIP. I put their website there at the very end, all about Medicare Advantage. It's very interesting. This comment came in. I truly appreciate all the valuable information you give us on the differences between Medicare Advantage plans versus traditional Medicare. I previously worked in a medical office billing department. I don't need to tell you how many calls I took from patients complaining about their Medicare Disadvantage plan costs. For physical therapy, some copays were as high as $60 per visit, which adds up quickly if you've had a total knee replacement, which my mom is doing tomorrow, and are being seen 2 to 3 times a week. You'll end up paying $480 to $720 for 4 weeks alone. I try to help all patients to understand their current insurance plan so they can make the right choice for their situation come open enrollment time. I also tell anyone that needs help to call you. Keep up the great work. Love your channel. That is very, very nice of you. I'm going to go to the comments now. If you've not yet left a comment, asked a question so I can send you to a resource, please do so now because I'm going to get them now. And here's our contact information. With that thing is really going to move. How about there? Hey, there we go. Let me pull up the comments here in the, let's see. Thank you for the information. Do you think I should give up my Medicare Advantage plan and just keep parts A and B? No. Having an Advantage plan, and sometimes people always ask the question like, why would I want to have a Medicare Advantage plan? If your budget does not afford you the opportunity to have a Medicare supplement, if you did not, during your working years, save for retirement to the point that you would not have to rely just on Social Security, if you did have a retirement program and so forth, then you have to do something. And having exposure to 20% of all the bills is not a good thing. There are some people that do argue that having just original Medicare is fine by itself, but there's just that unknown 20% of the cost with Part B, and more things are being done outpatient nowadays. Like they're trying to do my mom's knee surgery tomorrow, outpatient. That's incredible. That would be a Part B cost. She has a Medicare supplement. Doesn't matter what hospital she goes to. She picked the best orthopedic surgeon in the county. Why? Because she can. Does she have to look at a book? No. Does she have to then verify the book and call the doctor, since 50% of the Medicare Advantage provider directors are found to be wrong? No. She just gets to go. And if where I put my mom is any indication, then yeah, you should have a supplement if you can afford it. If you can't afford it, then you need to have an Advantage plan. I would suggest getting an Advantage plan from somebody who knows the entirety of the issue and can help guide you to a plan that might be most appropriate for your specific situation. And people ask all the time, how do we contact you? It's at the top of this page. It's in the description. And I'll put it again at the end of the screen here, but it's also on the channel. You can Google search that ugly name, Christopher Westphal, and find our contact information that way. We did a story not too long ago about the hospitals, and they're dropping Medicare Advantage. There's another story that came out Sunday. I didn't save the slide of it. It's more hospitals in the southwest part of the country that are now saying that they're going to have to close their doors because they're relying so much on Medicare Advantage and they pay so little. It's a very sad thing. Going through the things here. F-35s and Pentagon, and why wouldn't these problems happen at Medicare supplement companies? As I alluded to right after you typed that, Medicare supplement companies do not maintain a medical director, or they don't have what one lady affectionately called it, a denial department, which all they're ready to do is simply to deny care. That is a relic of the Advantage world. And you can see my graphic here. My mom was over this weekend and she didn't understand it. On the left-hand side, these are just claims automatically being paid, because when they're through original Medicare and your doctor, whoever your doctor you decide to have, says you need something medically done and it's medically necessary, the supplement company automatically pays what the original Medicare didn't pay through a program called crossover. It's automatic. There's not a human involved in crossover. Whereas if anything's going to cost them money on Medicare Advantage, they're going to try everything they can to mitigate what those costs are. That mechanism does not exist at all in the Medicare supplement world. There's just not someone that occupies that position of trying to deny claims. Bonnie said, they don't tell you anything. I did research and found Chris. Thank you, Chris, for helping all of us. We appreciate your time spent. So many people I talk to don't even know what they have. Boy, you should hear the stories we have in here. They call in all the time. So I've got this card. I don't know what it means. What is this for? And it's a very sad thing. It really is. Melissa, I just want to say thank you for explaining it so well and for your help. Without your help, I'd still be stressed out. Oh, that's my wife at home with grandbaby. Okay, here's a good question. How about a spouse of someone who is getting employer-based insurance? I left that 4 months ago, and I had to deal with the questions getting my Part N. Well, it's Plan N, and it's not a part of Medicare. Plan N is a supplement that sits on top of Part A and Part B. But if you left your employer-based insurance and you had to answer questions, that's because you had started your Part B back when you were at the employer. And if your employer has 20 employees or more, then you don't need to pay for Part B of Medicare. You simply don't need it because your insurance at work is going to be secondary to Medicare itself. It's going to be taking care of everything. You just don't need a supplement at that point. You don't need Part B even. So if you did start Part B early and you're past 6 months and you're beyond it, yes, you'd have to go through the underwriting, but it's not that big of a deal. We get people approved all the time. I think there are 20 people approved today. It's that we just dealt with. It's not a big deal. This is great. There are so many people in my area on Medicare Advantage that when I told my doctor I didn't need pre-authorization, he didn't believe me. I'm telling you, it happens all the time. The doctors just don't know. Oh, here's one. Sharon says, these people don't know squat. Talking about the people that we had playing a minute ago. If you ever worked in the medical field, these plans are junk and a nightmare for everyone. Of course, if you ever get an account of what happened when the doctor turned in the bill to Medicare, you'll see things like the bill was $500 and Medicare approved $80. They not only approved $80 to finish that thought, it was repriced at $80. That's right. And so if Medicare has the power of negotiation of 20-something million seniors and they tell the provider, this is what's on our fee schedule, that's what the doctor's going to get. And yes, you get the benefit of that repricing when you're on original Medicare. And then you pay 20% or your supplement pays the 20%. So Medicare pays 64 and the supplement pays 16. In that example, you'd be right. Now, if you're in an outpatient scenario and it's a $20,000 knee replacement or $30,000, the same numbers would exactly apply. You would be responsible for 20% of that, right out of your pocket and right now. Thank you, Kathy. If you've never been on Medicare Advantage, just original Medicare, then when a Medigap, is there still underwriting? Yes. If you are beyond 6 months from when you started Part B, then there's underwriting. Yes, indeed. Except in a couple of states, Connecticut, New York, Massachusetts, but for the majority, yes. Oh, well, I think I know this name. That's my wife. My mom has a Medicare supplement and was out of state last week. That's right. She was visiting her brother in Florida. She got hurt and was thankful knowing that supplement because she could see a doctor out of state and not worry about a network. That is true. A personal story that I forgot my wife shared here. Let's see. My wife works at a school system and she carries our health insurance. She retires in June of 2024. I turn 65 in April. Can I wait to apply for Medicare until June? Let's see, April, May, June. Yeah, you could. Yeah, you could. I wouldn't do that though. I would just get it when you're entitled to it because you've been paying into it for so long. Let me refresh this. Are there any other comments on here? Am I going to go to bed early tonight? That'd be fantastic. Well, I think it's been clear from the evidence tonight from the congressman who didn't know better and had an industry executive from the Medicare Advantage industry who blatantly had a one-sided presentation about the good, amazing, wonderful things about Medicare Advantage without going into the actual details of what actually happens. All the way to somebody that's on the stage right now, hoping to be the nominee on the Republican Party that just says Medicare Advantage is so great. How did she put it?
Entitlement reform, and that's how we'll start to pay down this debt.
How'd she say it?
Healthy, and then expand Medicare Advantage plans. Seniors love that, and let's make sure we do that so that they can have more competition. That's how we'll deal with entitlement reform.
That's what we need to do. We need to spend more money for Medicare Advantage to have it. Oh, yes, this is a great one. Thank you, Noah. Can you talk about the 12-month Medicare Advantage trial period called trial right? Can you get a supplement without underwriting with that? Yes. It's a little bit complicated because there are two versions of trial right. One gives you an open enrollment do-over, which means of all the plan letters, 10 of them with Medicare supplement, you can pick any plan that you want to. It's just like you're starting Part B all over again. That's the best kind of trial right that there is. What triggers that trial right? If when you started Medicare, you were led down a path from an agent who only told you that there was one way to go. And this is the overwhelming majority of what happens today. I know because I attend agent trainings all around the country. And the majority of those agents don't know diddly squat about Medicare Supplement, much less Medicare Supplement underwriting or which plan is better. Oh, Plan G pays more commission? Simple to explain. Let me sell that all day. But I digress. If they shoved you on, if they got you onto a Medicare Advantage plan that starts the same time as your Part A of Medicare starts, which means when you're brand new to Medicare, you started Part A on the first of the month that you turn 65, you started Part B on the first of the month that you turn 65, and you started the Medicare Advantage plan to start on the first of the month that you turn 65. Then you have a 12-month period called trial right, and you can try that program out as much as you want. When we hear about trial right, it's when somebody calls us and they say, and this happens all the time, I was signed up for this plan, I didn't know there was an alternative, something has now happened, and I'm in a nightmare scenario. How can you get me the heck off of this plan as soon as possible? Is there any way to do it? Yes, we've got the trial right. It's a do-over. Now, just between you and me, the insurance companies have found a way to screw over the insurance agent on trial right plans. You see, the letter of the law says that you get a do-over of open enrollment. When someone's in their open enrollment, initial election period, they get access to all the plans, not the one plan that people buy when they have guarantee issue. No, it's an open enrollment, not guarantee issue. The plans have gotten most of the states to adopt that if they have to issue a guarantee issue policy for Medicare Supplement, getting in the weeds here, I know this, but in certain circumstances, like if you have a Medicare Advantage plan and you move to another state, you've just left your area of Medicare Advantage plan, and they give you this special election period. And with that special election period, you can go get a Medicare Supplement, but the only one you can get of any note is Medicare Supplement Plan G. They have to give that to everybody by guarantee issue if you're triggering a special election period. And there are a few of them. If you Google search Medicare.gov space special election period or guarantee issue, either one will pull up the page where you can see all of these. Then you can only get Plan G. Medicare Supplement insurance companies always used to pay full commission to the agent if you're writing anybody for open enrollment. And open enrollment, how do you know if it's open enrollment? Oh, because the law says in open enrollment, you can get Plan N, you could get Plan K, you could get Plan J if they still sold it, you could get Plan G, you can get all the plans. The world is your oyster. Plan N even. Don't buy that. Plan L. You can get them all. That's the true definition of open enrollment. And that's what you get with trial right. So it should pay the agent as if you're being treated as open enrollment. But they don't. The insurance companies have flipped it and they said, we have to take this person. We really don't want to take this person. We have to give them the same rate as everybody else as if they're open enrollment again. We're going to take that out on you, the agent, and we're just not going to pay you for that. So trial right cases we don't get paid on anymore. Even though the law says they get open enrollment again, they should pay us as if it's open enrollment. But anyway, yeah, we don't run a nonprofit. We actually get paid to help people, and that's why it doesn't cost you anything to pay for our services. Woo! The second type of trial right is if you started Medicare Advantage later in life and you gave up a supplement in order to do so, and it's the first time you've ever started and tried a Medicare Advantage plan. Let me do that again. You're going through life on a Medicare Supplement plan. You chose a Plan G when you were eligible. You chose a Plan G anytime you wanted to, but for the first time, you want to go try a Medicare Advantage plan. So you're giving up your Plan G to go try a Medicare Advantage plan. Let's say you were on a Plan N. You followed some good wisdom from somebody and you got on a Plan N. You have low cost, you have low rate increase trajectory in the future, and you have low copays when you go to the doctor. Well, you're giving that up to go for a plan that has the YMCA membership. Woo, it's wonderful. Within that first year, you decide, oh my gosh, this plan does not work the way I intended. That free tube of toothpaste from Rite Aid is not worth giving up my ability to get my back surgery. Get me back into a Medicare supplement. Chris, what do I do? We'll say, well, since you left your Medicare supplement to go to an Advantage plan, the law says you can get that supplement back if it's available. It's only available for 60 days. The insurance company is not going to hold your rate and hold your policy waiting. Maybe they'll come back. it's not going to be available. So the law says you have guarantee issue to go get a guarantee issue Medicare supplement plan, which means you can't get Plan N again. Plan N, one of its best features is it's not available through guarantee issue, which means you can only get Plan N one of two ways. A brand new baby into Medicare at 65, the healthiest population there possibly is, or you go through underwriting questions later. Those are the only two ways you can get Plan N. That's why the population in Plan N is so much healthier. That's why the rate increases are so much better. So if you do leave your Plan N to go to a Medicare Advantage plan, please understand that if you want to come back, you have to do it within 12 months and you won't be able to get your Plan N back unless you can go through health underwriting. But the people who want to get off Medicare Advantage plan are the sick people who've determined when it's bad. And like Blumenthal said in his thing, oh, it's great until you need it for the big stuff. And that's when it falls apart. So that's how trial right works. Thanks for the long-winded explanation. Let's see. There are a few states that have, my wife is working from home. Our amazing agents write in almost every state. We know the ins and outs of each state. Thank you, Nicole. Get some rest. May not be able to get back to regular Medicare supplement. And that's the problem. That's the dichotomy of it all. And that's why the book says the best time to get a supplement is when you're new to Medicare. I get it. But there are certain circumstances where people just think that they cannot get underwritten. And in many, many, many cases, they're not accurate. That's not true. I had an agent the other day ask me, hey, I have somebody that has high blood pressure. You think it's possible at all to get them underwritten? Yes, every day and twice on Sunday. Read the questions on the application for Medicare supplement. Read the questions. They're not confusing. And it's not a thing like the guy just said, well, they can charge you a lot more if you're sicker. No, it's usually pass or fail. If you say, yes, I've got this bad condition, it's a fail. And that's why we represent a whole bunch of different companies so that if you're failing with one, maybe the one that has the best rate, you can't get there, we can pivot and go to another one. It might cost $2 more, but by experience, we know we can get that condition approved. And that's why it pays to go to somebody with experience. Wow. Been watching 7 years now. Holy moly. I'm getting old. I have a supplement plan and it's time for a colonoscopy. Do I need to use the group that my doctor set up for me? His setup was a courtesy Wow. Sorry, just closed the wrong screen. And we're back. No, you don't have to use that group. You can use any doctor in the United States of America that accepts original Medicare, which is just about everybody. Sure, doctors want to refer you to friends of theirs to do things, and maybe they have a good relationship with them and the flow of communication is better between them and their friends. But no, you don't have to do that. That's the best part. Like when my mom has to get a knee replacement, do you think she wants to go to the capitated doctor that gets paid the same whether you sees you or not, or does a good job or not, or whatever? No, you can find out who's the best orthopedic surgeon in the entire region, and then you can get on their calendar because you have Medicare. It's just exactly that same thing. That's exactly how it works. What about someone on a supplement plan G that would like to switch to N without underwriting in a state like California? Does that circumvent the agent's commission? What if you use a different agent? Yes, the commissions are less in every state that has guarantee issue provisions like this. California is one, Washington, Oregon, New York, Missouri. The commissions are always less for agents because they have to make up that money somewhere. Yes, and in California, you can go from a plan G to a plan N during the birthday rule, which is a 60-day period, 30 days of your birthday, but 30 days before your birthday, you can apply and make the application either on the first of the month of your birth month or the month after. But yes, you can do that. And does it circumvent agent commission? It is less. That is true. Let's see. Oh, she didn't. Talking about somebody who left the company because they didn't make a payment. Let me just speak to this for just a second. Please, if you're on a Medicare supplement plan, and you're one of the people who insists on paying everything manually from your Part B, where you mail it in every quarter because you don't have it coming out of Social Security, to your Medicare supplement premium that you're insisting on paying it annually or quarterly, especially when there's no benefit to do so. Now, I know all states now giving a discount if you pay it semi-annually or annually. That's not common. Usually there's no financial incentive for you to pay it up front like you would on a life insurance policy. You typically get it 1 month off. The point is this: our neighbor fell and broke her hip across the street from our house when we lived in Florida. She was on a Medicare supplement plan. She lost it because by the time she went to the hospital, went to skilled nursing, went to all that stuff, she didn't write the check to pay her premium for her Medicare supplement. So she lost it. And since it was more than 30 days later, she lost it and couldn't get it back. Your Medicare insurance premium that you count on for life-saving treatment should be on direct bank draft. They're not going to slip in an extra $1,000 bill on you. Not these Fortune 500 companies. It just doesn't happen. That's the only thing. Please trust me when you hear this. It's the only thing that you can count on to draft the premium for you, and your Part B also should be on auto draft. If you don't have your Part B on auto draft, even if you're not getting Social Security right now, you've deferred that, go to mymedicare.gov and set up the monthly auto draft for your Part B of Medicare premium. Trust me, it may save your life one day. You don't lose that coverage. Let's see. Can you speak about Part F? There is no Part F. There's a Plan F, and I just read that wrong. I can speak to that. In 2010, I made a website called Plan G is Better. And I was talking about the very thing happening back then with, let's see, AT&T, IBM, UPS, where they had all their employees being kicked off their employer-covered plans and letting them go through one company to buy a Medicare supplement. And they were giving them HRA money to do so. And they're all getting on this, the guarantee issue plan was Plan F at the time. And I was telling people, hey, just actuarially speaking, if you're just even a field underwriter, you'll know that if you have millions of people being poured into a plan, like the guarantee issue plan, which was back in the day, it was Plan F, then what that's going to do is skew the numbers in a big way. And back then, Plan G was not guarantee issue. Plan F was the guarantee issue. And I call it the dumping ground. It's where everybody has to go. And if you think about it, the insurance lobby made it this way. They make more money on the guarantee issue plans because they lose money on guarantee issue plans. They can't underwrite them. They have to take them. So they said to Congress, hey, if we have to take somebody, can you please put them on the plan that pays us the most money? And Plan F has always been a foolish plan to be on, because the only difference between Plan F and Plan G is Plan F pays the deductible, the Medicare deductible. Okay, so it's going to be $240. But what we would consistently see is people were paying $700 a year for a benefit that only is $240 benefit. So the administrative fee of that is 200%. Never made sense to be on Plan F, ever. But then when Plan G took over as the guarantee issue default, the dumping ground, that's when we look closer at Plan N. And Plan N has proven me correct. And if you look at the website called plannmedicare.org, do I even have it on here? Plannmedicare.org. Look at the examples. Look at what I predicted and when I said it, and then look at example from the insurance companies, where you'll see Plan N rate increase 0%, Plan G 9%, Plan G 3%, Plan G 12%. And you see those. And if you expect to be on Medicare for longer than the next 3 years, then you must look at the long-term longevity of the plan letter that you're on. Is it inconvenient at times to have to pay a copay or wait for Medicare to go through its cycle, pay what they're going to pay, then you're left with the copay to pay? Yes, that's not as convenient as just one card swipes all, and it's the all-you-can-eat buffet of Plan G. But with that convenience, it's going to catch up to you. The people who go for Plan G are the all-you-can-eat buffet people. And if you're deciding on which plan and you're turning 65 and you're like, you know what, I go to the doctor about twice a week or twice a month or all the time, I've got these chronic conditions already, yeah, Plan G will be the best fit for you. And so you and everybody else who goes to the doctor a whole lot of times are going to share in the benefit or the disaster that is that kind of overutilization of the plan. So if everybody's using it a lot more, the cost for everybody's going to go up a lot faster. Meanwhile, Plan N is typically purchased by people who are more cost conscious and are in reasonably good health. So they don't go to the doctor all that much. And if they don't go to the doctor and there's a small little speed bump to go to the doctor, and that is that small up to $20 copay, you're in with a healthier risk pool of people who've chosen that plan. And that's why the rates go up a lot less on Plan N. That pays us on average 26% less commission. But you won't see me screaming in front of a board saying Plan G is sold to 80% of my customers. I'll just leave that right there. Yep, let's see. How do you enroll in a copay protection plan, $30 a month in Advantage plan? Well, it's not in the Advantage plan. It's a separate policy. You can reach out to us and we can put you on the schedule for that. It's a very simple underwriting process. And actually, we have one company now that if you're between the ages of 64 and 79, I believe that's right, maybe it's 74, then it's guarantee issue. There's one company out there with great rates, great track record, that's making these hospital indemnity plans, and that's what it is. They're making that guarantee issue, and we can help you with that. Understand that that's not an open enrollment feature. You don't have to secure that before December 7th. If you want to get on our calendar for a consultation on December 8th, 9th, 10th, 11th, 12th, whatever that is, then let's do that. Because this period of time is so small and so reserved for those people who have to have December 7th as a deadline, then we really want to help those people who have the December 7th deadline. And that only pertains to Medicare Advantage, not Medicare Supplement. All Medicare Supplement business, unless you're trying to get off of an Advantage plan, all supplement business can wait until December 8th and beyond. That way the companies are not overwhelmed with underwriting. That way our schedule's up. That way our phones are back on and we can take actual incoming calls and actually help people in real time. So yes, we can help you with that. But it's not part of Medicare Advantage. It's a totally separate thing. And they pay you that money directly, by the way. It's a good thing. Let's see. Maybe high deductible Plan G or N is, in my guess. I missed the context of that. No, I'm sorry. By the way, Plan F is no longer available. Should mention that. No longer available if you were eligible for Medicare on or after January 1, 2020. And when that law was proposed, I did a video about it at the time. Gosh, what was it called? Something parody. It was the 𝗏𝗏𝗃 bill that was passed in 2018. And as soon as it was passed, I predicted what was going to happen. Plan G is going to be guarantee issue. Plan N is going to be an even better deal. And that's when I created plannmedicare.org and have been proven right every month and every quarter and every year since then. And I find it funny that some people are on YouTube saying, now we really don't know if this theory is correct, that Plan N would have better rate increases. Yes, we do know. And I've been documenting it since 2018, exactly what I predicted. I mean, it just makes actuarial sense if you think about it. And it's true. The companies have gone with that. Let's see. Okay. And that'll about wrap it up. And I've lost all of my videos and all of my screens and everything when I ditched the thing. But you know what? That's what happens when you go live and you're trying to give and help people. So I will end it there. I really appreciate you all with your questions. Please leave comments if you're watching this live stream later. Leave your comments below. If you have an acute situation and you need an answer in a timely fashion, the comments on YouTube is not where to leave that information. That's not where to ask, hey, here's my situation. What would you do? A comment is a comment. It's commentary on something that you saw. What's your opinion? What's your story that we could share with other people? Timely things cannot be left in comments and expect a timely result. I'm saying this because we're getting hundreds and hundreds and hundreds a day, and I don't want to look at something, maybe I get to it weeks later or after the annual election period and go, oh my gosh, this person needed help and didn't reach out. They thought that this comment was the place to reach out to us. It's not. We can't help you there. Please don't put personal information in the comments. Don't put your real name on YouTube. That's not a really good idea so that it shows up. And don't leave personal health information in the comments. Please, I'm just trying to protect you. Don't want that information out there. Guard your information. More scams coming out there. What do you recommend? One more time. What do you recommend if you have VA health now and you're turning 65 in a few months? Book an appointment with us. We have some great options for you. Great options for you. Just go to seniorsavingsnetwork.org and click the Medicare Help button and choose that you're new to Medicare, and we'll book you the highest priority thing because we know you want to take care of that. And we've got some great options for people who are veterans and they use the VA for all their health care, like my father-in-law does. Great, great programs. Patricia Allen, I know you. You're an awesome agent. Love you. And I can't wait to see you at the next company training or trip or wherever we get out to. Are there any other plans beside Plan N worth considering? Plan L and Plan K, I would never consider. Actually, I did a video on that just a couple of weeks ago. It's called All the Plan Letters. I'll link it here after this video is done and recycled through the thing where I can do so. I'll also link it in the description of this video. It goes over all those plans, but in most cases, it's either going to be Plan G for high users, Plan N for the more reasonable and for long-term viability of your plan. And yeah, that's about it. God bless you. Thank you for being here. Really appreciate you very much. And we will see you next time.